Means that I went to medical school as part of my training, whereas a psychologist gets their PhD. But as part of my training, I did a lot of training in psychotherapy and counseling and parent guidance and that kind of thing. So I'm not just trained in the medical side of things. I work full-time at Kennebec Behavioral Health in the Winthrop office. I see kids ages 3 to 23. I think American adolescence doesn't end until about age 26, but we do have to cut it off at something. So usually 23 is when I'm kicking kids out. I also, one day a week, I'm at Bates College and I see kids at the college in the health center. And so I have some perspective on transitioning to college as well, and college age kids and some of the things that they cope with. So I did gear this talk mostly towards caregivers, parents. I don't know if people here have professional questions or questions about work. I'm gonna try and keep it as open as possible. I didn't pick the topic. It's a very broad topic. It's an important topic. But as a result, I'm gonna talk in sort of broad generalities. I copied a bunch of facts for families on specifics about particular kinds of events, like dealing with a sick parent or transitioning to college, that kind of thing. And I'll give you more information on where you can access some more of those flyers. But I'm not going to talk off of those flyers. That's really more for your reference once the talk is done. I'm starting off with this quote, not because I'm trying to be cliche, but because I like it. I think if you sort of think of a child saying this, and I like that the person who said it was an author for children, I am not afraid of storms, for I am learning how to sail my ship. When you're trying to help children, I think oftentimes as parents and caregivers, we try to be problem solvers and we try to sail the ship for them. And what we have to remember is that our role is really to teach them how to navigate themselves. And that can be somewhat counterintuitive for most caregivers, and one of the biggest challenges. So as I was thinking about this topic, I was thinking, well, what are significant events? I think that's really relative. What's a significant event to a child very often will not be a significant event to an adult or to a parent. And sometimes it could be something as severe as loss, death of a loved one, death of a friend, to something that seems more trivial in the adult world, like the loss of a pet or the moving away of a best friend. But for kids, these experiences, these changes in life circumstances can be really experienced as life-altering events. It can change their perspective depending on what developmental level they're at, and it can change the way they view themselves and their identity. Other things to think about is adolescents and teenagers. Oftentimes what's going on with their peers is far more important than what's going on at home. That's developmentally appropriate, though incredibly frustrating to most parents. And so oftentimes when they have peers change, like friendships that change or social groups that change, you may not hear about it at home, but again, you may see a major change in your child as a result of that. And then failures. A child may have failed out of their own perception. Nobody else may have seen what they've done as a failure, but if they perceive it as a failure, they may react to it in a negative way. And sometimes it's hard to see it if you're not sure what to look for. So since most children and most adolescents have a really hard time sort of expressing what they're going through, oftentimes you're playing detective, both as a caregiver and as a provider. You're trying to sort of figure out what's going on. That's easier said than done. Oftentimes the child is not going to be helpful in this because oftentimes the child doesn't know what's wrong. So oftentimes kids just feel yucky and they don't know why. They aren't able to sort of connect the feeling to the event. And sometimes your job is to help them do that. So sometimes when you're playing detective, you have to think about, okay, what are the things to watch for? The biggest thing typically is a change in function. So this is an example, some loss of interest in school or activities, A good example is, gee, for some reason, Joe doesn't want to go out for the football team this year, even though he's gone out the last 3 years. You know, maybe somebody all of a sudden doesn't want to hang out with their friends, even though they're a social butterfly. Maybe someone who's a straight A student goes, you know, all of a sudden is making all C's. And it could be something that, you know, oftentimes parents will try to sort of explain away, because it's easier to think that it's some, you know, minor environmental change than to think that your child has experienced severe trauma or loss. So, you know, well, gee, you know, they're not doing so well in school this year, but the classes are a lot harder. And so, you know, as opposed to, gee, there's something inherently different with the way my child is coping. Physical complaints are really common. Oftentimes I'll get referrals from pediatricians because they've worked up a stomach complaint up one side and down the other, and they have not found any cause for it. Stomach ache is probably the most common thing that I see in kids ages 7 to 12, and no physical reason for it, but they're experiencing it typically because they've experienced some kind of loss or difficulty, and they're feeling it in their body. The feeling is the same, so this is important. These kids are not faking. You know, they really are having headaches and stomach aches. They really feel sick. It's just that the source of the sickness is something a pediatrician typically can't help them with. And that can be frustrating to parents. Oftentimes I have to remind parents, I'm like, oh, that's good news that there's nothing medically wrong, because it would be easier for it to be something that they could just sort of give a medication to and fix, as opposed to something that's a larger life-changing event that needs to be addressed. Muscle aches and pains are really common, especially in younger children. Teenagers often complain about having headaches and feeling tired. That's a big one. I'm really tired. I can't understand why I have no energy. And changes in sleep or appetite. So a kid and that can go up or down. So some kids sleep, 14 hours a day, and some kids don't sleep at all, and some kids all of a sudden gain 20 pounds, and some kids lose. And it really is very specific to the child. This is where, in my position, a provider is essential, because I don't know your child. I haven't lived with your child your whole life, and oftentimes I'm looking to the parent to tell me, what are the patterns with your child? Is this typical? When have you seen this before? And so that's just a really important thing for a parent or caregiver to be tuned into. So what's needed when we're helping kids go through these events? And this is just sort of like these global things that are going to be helpful in any situation where a child is having a difficulty. You really need to be focusing on these things. The most important thing is empathy. That's very easily said. It's very difficult to do. Part of the reason that's difficult to do is because it's really hard to sort of really put yourself in the child's shoes, because we're not children. And our memories of being children are altered by our experience. They're not as genuine as they were happening. Consistency, and we'll talk more about that. That's the one that most people know. I mean, it's sort of like, you hear this all the time, like keep their routine the same, make sure that they're not dealing with any major changes, get them to all their activities. Managing emotional reactions, that isn't just for the child, that's for the caregiver. So oftentimes when there's a significant event happening, the caregiver's going through it too. That could be something like divorce or death of a loved one. The parent is going through their own grief and anger and frustration. And how do you manage that at the same time that you're trying to teach your child how to navigate this situation? Guidance. For most parents, guidance is something that typically, again, falls into the problem-solving realm. Tell them what to do, whereas oftentimes guidance is much more subtle than that. So let's start with empathy. The child's perspective, this is very, very tough, and I think something that I spent years developing when I was in training is, being able to really kind of imagine what it's like to be 7 again. That's very hard to do. Our brains don't work that way. Cognitively, we don't operate like 7-year-olds. We have abstract thinking, we have planning, we have problem solving. We're not able to, and when we think about what it was like to be 7, our memories are very distorted. Our memories are distorted by experience. They're distorted by what we want to remember versus what we actually remember. They're distorted by family legend. So if a story gets told 500 times, oftentimes your memory of what happened changes with those stories. And so oftentimes what you really have to do is kind of stop and take yourself out of your own head and really begin to try to imagine, what would I feel like if I was that age and dealing with that situation? Listening is key. Listening is an active thing. It's not a passive thing. Most parents, as they're listening, and most caregivers, as they're listening, are coming up with a response as they're listening. So they're sort of anticipating what the child's going to say, and they're thinking about, how am I going to respond to this? That's the last thing that most kids need. Oftentimes, silence is key. So if you are listening and you're trying to really hear the kid, you want to make sure you're processing what they're saying. Very often kids will say, you're not listening to me, and the parent will say, no, I'm just not agreeing with you. There is some truth to that. I mean, certainly sometimes kids equate listening with agreeing with me. But sometimes what the kid is saying is, you're not understanding why I'm struggling. So oftentimes parents will sort of forget to say, I know this is hard for you. You still have to do what I'm asking you to do. I'm sorry that you're feeling that you're in pain. I'm sorry that you're sad. I'm sorry that you're angry. Because when you acknowledge those feelings, it doesn't mean that you're agreeing with what they want to do about them. It just means that you're acknowledging that they're there. And so oftentimes active listening means trying to hear what the feelings are, because most kids aren't going to come to you and say, gee, I'm really frustrated and feeling isolated because my friend Timmy moved away and I have nobody to play with at recess. They're just going to come home and say, I hate school, school's stupid, I don't want to go tomorrow, right? And so what you have to do is you have to, again, start the detective work and start asking questions. But you have to ask the questions as if you want to have full answers, not as if you're looking for a specific answer. Remember that your own feelings may be an obstacle. Parental anxiety is a real big obstacle. Most parents have a lot of anxiety about their children, especially when their children are suffering or in pain. And most kids, especially teenagers, will interpret that anxiety in the wrong way. So I probably say at least 5 times a week to a teenager, try to remember that what your parent is doing is coming from a loving place. It's not coming from a controlling place. It's not coming from a vindictive place. It may feel that way, but it's actually coming from a loving place. And so making sure that as you feel your feelings and you express your feelings, that you go back to that child's perspective. How is my child going to hear what I have to say? How are they going to interpret my tone of voice? If my child is feeling vulnerable and scared, are they going to be likely to hear what I'm saying as supportive or as criticism? And that's, again, easier said than done. And sometimes your child will give you those cues. You'll start to sort of say something one way, and they'll sort of shrink, or they'll quiet down, or they'll shut down. That's not your sign to push harder. That's your sign to sort of pull back, regroup, and then try a different tack. Consistency, again, most people know this. This is probably one of the hardest things to do, especially if it's a really life-altering event like the death of a loved one, a divorce, a big move, medical illness, or like medical illness in a child. It can be really hard to maintain these things. But you got to remember that we're animals, and we are very cued into our environments. And we're cued into every aspect of our environments. We're cued into the smell. We're cued into the lighting. We're cued into the temperature. We're cued into all these things that we don't register on a conscious basis. And so something as simple as like being in your own living room can be an incredibly soothing thing for a child. However, you want to make sure that you're keeping their life as normal as possible. You want to make sure that they're getting to their games. You want to make sure that if you typically go to their games, that you go to as many as you possibly can. You want to make sure that you're getting to the parent-teacher conference. You want to make sure that, that they're still getting play dates with their friends. All of these things are going to be important. Oftentimes, especially in situations like divorce, parents are going through an enormous turmoil, oftentimes the biggest turmoil they've ever been through in their lives. And they're so caught up in their own experience that it makes it really difficult to sort of stop and think about, gee, this is more important than it might feel. Whether or not John gets to piano practice may seem really kind of trivial when somebody has to drive 2 hours for a visit and that kind of thing. At some point, the adults have to kind of step back and say, okay, what's going to be the best thing for the child, not what's going to be the most convenient thing for us. Easier said than done. Expectations. Just because you want your child to stay in their activities, you want them to get to school, you want them to get their activities, you have to change your expectations for the child sometimes. Yes, they're getting to school. Maybe the fact that they're zoning out in class is not the thing to harp on right now. Maybe the fact that their grades are slipping a little bit is understandable in certain circumstances. Maybe just going to the game and sitting on the bench is enough. Maybe playing is going to be too much. In terms of, helping your child to stay in their life, what you also have to do is remember that staying in your life doesn't mean doing it as perfectly as you did it before, but maybe just kind of going through the motions might be enough to be soothing to a child. Emotional response. Emotional responses are tough because we don't think rationally when we're emotional. When we're angry, when we're sad, when we're nervous, we don't stop and think, A leads to B leads to C. Our brains just kind of turn that part of it's off. So you got this limbic system, which is your emotional center, and it's firing off in this kind of like pseudo seizure, and the frontal lobe is just kind of shutting down. And so that's the part of your brain that you need the most at those situations. And so if the parent's experiencing loss at the same time, again, really hard to step back and say, gee, my child's feelings in some ways are far more important than my own right now. So oftentimes, I'm saying to parents, you need to attend to your own emotional needs. So I might say, you need to go see a therapist, you need to go see your own doctor, and they'll kind of look at me like, I don't have time for that. I need to take care of my kids. I have 1,000,001 things going on. And I say, well, until you attend to your own emotional needs outside of your caregiver-child relationship, you're not doing your job. Because if you're not attending to those things, you're not a good caregiver. You're going to be a subpar caregiver, and you may actually end up doing more damage than helping. Even though you're giving your kid tons of time, you might be giving them really toxic time, which is not going to necessarily be helpful. And there's no need to be perfect. I think, in terms of parenting, one of my favorite sayings is good enough parenting, which was this psychologist who came up with this back in like the 1970s. And it's one of my favorite sayings. You really only have to do it right most of the time. Most parents make mistakes. I don't know any perfect parents, myself included. I was trained in this for years, which my daughter keeps reminding me of. So, the fact of the matter is, we all make mistakes. We all do things wrong sometimes. The fact of the matter is, as long as you're getting it right most of the time, and as long as you're willing to acknowledge when you've messed up, most kids can forgive you. And in some ways, most kids want to see you mess up, and they want to see how you handle messing up. They want to see, if you sort of are sitting at dinner and you just break down crying into your mashed potatoes, right? And you're bawling your eyes out, and that's the last thing your kid needs to see. That's where you regroup and you say, you know what? I'm having a rough day and I started crying there. I don't want you to worry about me. I'm okay. I feel sad sometimes, but that doesn't mean that I'm falling apart. It just means that I feel sad, and when I feel sad, sometimes I cry. But everything's gonna be all right, and I've got it together. So I'm sorry if that upset you. So that's acknowledging the emotion. It's showing the child you can be sad or you can be angry and still be functional. And that's what you really want to give the child. You want to give them that example. So guidance. Guidance is usually not directive. Not always. Sometimes kids want you to be directive. Sometimes kids want you to say, you're tired, you need to get to sleep, you need to eat your dinner, you need to get your homework done, because honestly, their frontal lobes aren't working and they kind of need you to be the frontal lobe for a night. And so sometimes they want you to do that. But most of the time, kids are taking cues from what you're doing. They're taking cues from their environment. They're watching your behavior. They're not listening to your words. So, I always say model the behavior you want. if you're losing your temper, if you're having a hard time managing your own anger, if you're having a hard time managing your own anxiety and engaging in positive coping strategies, then you don't really have a right to expect that from your child. You're an adult and you have a cognitive capacity that your child doesn't have. If you're struggling with that, then you kind of don't get to criticize your child for struggling with that. It doesn't mean that it makes it okay. It doesn't mean that your child gets to do whatever they want. It just means that you have to attend to that part of yourself first before you can expect your child to attend to it. And avoid trying to solve the problem. My favorite thing, especially with teenagers, is this. I'm going to date myself. Has anybody ever seen the show Columbo? There's like this. So he's this detective, and he always kind of acts stupid. He plays dumb. He's like, explain this to me. Teenagers and preteens love to teach. They love to sort of put you in the student seat and to show you, what's really going on. And so the best thing you can do is kind of just act dumb. Sort of say, well, I'm confused, why would somebody do that? You know exactly why their friend did what they did, but you have to kind of get them to start to think about it. And so you say, well, why would so-and-so yell at you? And then your child has to start to think. They have to start to harness those self-examining areas, those introspective areas, where they're starting to think about, why do things happen and how can I respond based on those things. It's actually kind of fun. I mean, if once you sort of feel comfortable with looking dumb, which, that's an important thing as a parent, it's actually kind of cool to hear what your child has to say, because what's amazing is they've already figured out most of the stuff. It's just that they haven't really had a chance to express it, and you're giving them that chance to do it. You also want to give your child as much control as possible. Oftentimes, significant events can include crossing of boundaries, and that could be crossing of physical boundaries, that could be crossing of emotional boundaries. And so what you really want to do is to allow your child to redraw their boundaries. So for example, making a child tell you what happened is really usually pretty abusive in and of itself. So sort of like the tell me what happened, tell me what they did. Oftentimes you're not going to get the real story if you do that. You're going to get what the child thinks you want to hear, because the child is eager to please you, because you're their primary attachment figure. And oftentimes you're going to put the child in a situation where they may compromise their own integrity, and they may say something that they regret and then later feel like they can't take it back. And that can be its own trauma, because then the child is stuck with sort of this feeling of being alone with their feelings. So a lot of what you want to do is sort of say, when you're ready, I'm here. You seem like you're really sad. You seem like you're really angry. And when the child says no, say, well, I might be wrong. Don't argue with them. Don't say, no, you look angry, you're yelling, you're screaming, you're throwing stuff. Say, okay, I might be wrong, but that was what I saw. When I looked at you and I saw what you were doing, I thought, gee, that seems like a pretty angry way to react to something. And then say, and if I'm wrong, great, I'm glad you're doing okay. If I'm not wrong and you are feeling awful, please, I'm here, I want to talk, I'm available. And then checking in with them periodically as time goes on. Giving them as much control as appropriate and safe. Obviously, if your child is struggling with something like mental illness, or your child is self-destructive, you do have to try and protect them from themselves. That's trickier with teenagers because honestly, it's almost impossible to protect teenagers from themselves. And if you spend too much time trying to control their behavior, they're going to do it anyway. You're just not going to know about it. And if you don't know about it, you can't be helpful to them. And so, that doesn't mean giving a kid carte blanche, but it does mean sometimes saying, I don't agree with the choices that you're making, and here's why, but I also can't stop you, unfortunately. And if you do get into trouble, I'm here to help you. Potential complications. So oftentimes, I'll see kids who have intellectual disabilities, or they have very low functioning autism, and that makes it even harder for kids to express what they're going through. And so oftentimes, you might have a kid who's acting out, or who's becoming aggressive, or really sort of becoming a major behavioral difficulty. And everybody's so focused on trying to get the behavior under control, no one's sort of trying to figure out what the source of the behavior is. So for example, in a kid with autism, a change of staff in their classroom, which might happen 5 times a year and seem like no big deal, might be a life-altering event for that child if that was the one person they connected with in the classroom. And so oftentimes, parents will come in and be like, I don't know what happened, he was doing fine, and then 2 weeks ago, he started tearing the place apart, he was crying all the time, and I'll say, well, what's going on? What's happening in the classroom? Any changes in staff? Any changes in the environment? Have they moved classrooms? You have to sort of, again, put on that detective work, even more so with kids with those kinds of limitations. An impaired caregiver, so a caregiver struggling with depression or anxiety themselves. One of the things that I often see is that anxious parents over-empathize with anxious children, and they try to fix it for them. So there's sort of this feeling of, I know what it's like to be in that much pain. I know what it's like to be that anxious, and I don't want you to have to feel that way. And so, they kind of swoop in, and then they sort of develop this kind of codependent relationship of sort of protecting each other and becoming anxious and that becomes a really negative dynamic for the child. It comes, again, from a loving place. It comes from a parent who doesn't want their child to suffer. It comes from a parent who wants to protect their child. It's just that they're not doing it in the right way. And so helping them to sort of stand back and say, okay, what's going on with me? What are my feelings, and how am I projecting that onto my child? An impaired caregiver could be a grieving parent as well. If you're grieving, it's often really hard, even if you're the best of people and the most resilient of people, to be able to be available to your children emotionally. And that's where you really have to kind of look outside yourself for help when you need to. Lack of resources. I don't just mean money here. In fact, I don't mean money at all. I mean emotional resources. So oftentimes people might not have relatives in the area. They might not have a lot of close friends. They might not have the kind of community support, especially if it's like a move or something like that they might typically have, which makes it harder for you. It really does take a village to raise a child. I mean, not to use a terrible cliche, but that's true. And so if you're kind of feeling isolated, that's going to be that much harder. Common mistakes, one of the one I see very often is parents looking to their child for support that's not age appropriate, it's not developmentally appropriate. I frequently see this in divorce. So what happens is parents get divorced, they no longer have that sort of person that they told everything to, and now they're alone with their kid, half the week, and they start having those conversations with their child because the spouse is no longer there to have them. And they don't necessarily have the friendships that they had before they were married because they haven't cultivated those friendships because of the marriage. And so as a result, the child ends up absorbing a lot of that. Many children will reject this, and I think that's incredibly healthy. So when a child sort of starts to act out or say, I don't want to talk about this, or sort of is a problem, they're actually saying, this is my boundary and you're crossing it and I don't want to talk about that. Stop bad-mouthing dad, or stop saying, something, happened that didn't, that kind of thing. But some kids, and these are kids who are incredibly empathic, they're actually really awesome kids in some ways, they're kids that many people sort of gravitate towards, will take on this role and they will do it gangbusters because they want to make their parent happy. And that's when a child becomes parentified. So then you have a child who's now taking care of the parent, who's making sure that the parent is emotionally taken care of. They might be doing the heavy lifting around the house in terms of organization and making sure that younger siblings get taken care of and that kind of thing. As wonderful as that might be for the impaired parent, it's actually incredibly bad for the child. When you accelerate development like that, it really you rob the child of something that they'll never get back, and they will oftentimes struggle with feelings of emptiness into adulthood because they sort of lost this period of nurturing. Displaying emotions that are frightening without reassurance and explanation. Everybody loses their temper sometimes. Everybody kind of starts bawling. If you don't explain where those feelings came from and you don't explain why you need to regulate them, that could be a problem. Expecting a child to adjust and adapt at the same rate than an adult would. This is really common. We all do this. It's kind of like, why isn't he over this already? Let's move on. We're doing fine. How come he's not doing fine? again, children are working at a lower cognitive level, and they're processing, everything's brand new to them. They've not done this before in any way, shape, or form. It's going to take them longer to process the lesson, and it's going to take them longer to develop the coping strategy to deal with it. And being critical or too directive when a child is trying to adjust, sort of saying like, that's it, come on, you got to get over it, you got to get up, you got to go to school, what's your problem, We've been over this before, as opposed to, I know you're struggling, I know this is hard, I know you feel lousy, and unfortunately you still have to get up and go to school. And how can I help you to do that? You're asking the same thing of the child. You're not placing a demand, you're just placing the demand in a different way. So in terms of resources, if you don't have a lot of family resources or friends, you can look to organizations. We have a representative here from NAMI, and NAMI is a wonderful organization, the National Alliance of the Mentally Ill, I got it right. There's the Facts for Families. You can find that on the ACAP website, acap.org. They have 1 million of those. Those are just some of them. There's a ton of them, and they actually have them in different languages too. For kids experiencing abuse of various kinds, there's the National Children's Traumatic Stress Center and the National Children's Advocacy Center. And then if you have a parent who's dealing with a serious medical illness like cancer or something else, there's the PACT program, and that's through Mass General, and they actually have a number of things on their website that you can look at, resources, books, that kind of thing, to kind of help you figure out how to navigate that. Oftentimes, and there's actually a Facts for Families on how to talk to a child of a parent with cancer, And that's it. I will take questions if you have them. I'm happy to talk about specific situations too if people feel comfortable asking those questions. It doesn't have to be general. Yeah, it's actually a pretty common question I get asked is, how do I break this to my child? And that it could be a lot of different things. Most of the time, kids already know. Kids are great detectives themselves, and they've already read all your body signals, even if you've been really good and not spoken about it in front of them and made sure they didn't overhear any phone conversations and made sure that you didn't say anything. Most kids will pick up on your body posture and your tone of voice and how tired you look. They can read you like a book, and so if you're struggling and they don't know why you're struggling, that's much scarier oftentimes than knowing the truth. In your case, it sounds like you were dealing with your own denial, and so they weren't reading the signals because of that. Yeah. And that's why it's so important for folks to address their own difficulties, because again, your children were looking to you, right? Yeah. Now it's nice because there's more resources. So like in a situation like that, we were talking about this earlier, there might have been a child life specialist or somebody like that who would have approached you and asked you those questions early on. So in many ways, those kinds of resources are improved quite a bit. But there's still a lot. A big one that I looked at when I was in medical training was medical illness, and how the medical system deals with kids that are ill or with parents that are ill. And oftentimes there's such a focus on what needs to happen intervention-wise that people sort of lose sight of the big picture. And that so often what really needs to be addressed is what people are going through emotionally, what their needs are as they deal with this news. And there's been an insensitivity to that. I think it's getting better, but for a long time there was a huge insensitivity to that.